Okay. Hi, my name's Riley, and this is my nursing certification presentation for Nursing 455. So, the certifications that I will be talking about, all of them closely relate to what my job will be after graduation, which will be in the cardiac specialty. I'll be working on a heart and vascular floor. So, with that, there's a lot of different certifications that I have the opportunity to obtain. But the three that I will be talking about today is the ELSO Adult ECMO certification, the CCRN, and the cardiac vascular nursing certification. So, starting off with the ECMO certification, the ECMO certification just basically demonstrates that you're knowledgeable about the ECMO process and providing that care for those critically ill patients. ECMO stands for extracorporeal membrane oxygenation and is a life support technique that provides temporary assistance to both the heart and lungs when they're unable to function. This certification is mostly obtained by nurses who work in a CVICU or any type of cardiac care unit or a pulmonary ICU. With my job, I would have the eventual opportunity to transition to the CVICU. So that's definitely something I'm going to keep in mind. And this is why I chose this certification as one that I would want to pursue. So, to obtain the ECMO certification through ELSO, it consists of three different aspects. So, the first aspect is completing a didactic course. There are a couple different routes that you can take this course. There is an in person option, and then there is also an online option. The second aspect is to complete a simulation lab through ELSO, or you can do other in person courses, which include but are not limited to any of their what they deem essential simulation scenarios, which I have listed. They include drainage insufficiency and air embolism, pump failure, membrane lung failure, or gas failure. The last aspect of the certification is just clinical bedside experience and getting those hours, and signed attestation of your institution verifying a completion of 16 to 32 proctored hours or about 2 to 4 ECMO days, followed by a minimum of 1 8-hour shift or 1 day every 8 weeks for an average of 56 hours of ECMO patient care per year for a minimum of 6 months. After completing all of those requirements, you can then submit an application, and if your application is accepted, you'll be able to pick a test date. The ECMO certification does last for 3 years, but after that time period, you just have to submit an application for recertification. The second certification I will be talking about is the CCRN. So, the CCRN is a critical care nursing certification or a critical care registered nurse certification, and it's for nurses who provide direct care to acutely or critically ill patients, regardless of their location. Basically, what that means is whether it's adult, peds, neonatal patients, like you can get this certification no matter what location those patients are in. Um, but they must work in areas of critical care like intensive care units, cardiac care units, trauma units, or like a flight nurse. This is a great certification to also pursue because I would like to work in potentially an intensive care unit. I'll be starting out in a cardiac care unit. And I've also very seriously thought about eventually also considering a flight nurse. So this certification would definitely help me obtain all three of those potential goals. So to attain this certification, there are two different options. The first takes 2 years, and the requirements are to practice as an RN or an advanced practice registered nurse for 1,750 hours of direct patient care to critically or acutely ill patients in the past 2 years, with 875 of those hours accrued in the most recent year before you apply. The second option takes a little bit longer, so it takes 5 years, and the requirements are to practice again as an RN or an advanced practice RN during the previous 5 years with a minimum of 2,000 direct care critically ill patient hours, with 144 of those hours being accrued in the most recent year leading up to your application. So again, this certification is good for 3 years before you have to renew it. And there's also a couple ways that you can go about doing that. So for both options, you have to have completed 432 hours of direct care during the 3-year certification period, with 144 of those hours being accrued within that 12-month period before you apply again. Then you can either take an exam to renew it, or you can complete 100 continuing education recognition points. And they had all of them listed on the website where I was getting my information from. So you can choose any of those. And once you complete them, you can renew your certification. The last certification that I will be talking about is the cardiac vascular nursing certification. So this is through the ANCC and is a board certification examination that basically proves competency in cardiac vascular specialty and knowledge after your initial RN licensure. I think this would be a good certification to have, again, because I'm starting out on a heart and vascular floor, hopefully transitioning to a CVICU. This would just be a great certification to have because I intend on working in a cardiac vascular specialty for quite a while right after I graduate. The requirements to submit the application for the certification is to have a valid active RN license, have practiced the equivalent of 2 years full time. So you have to have at least 2 years under your belt. You can't apply for this right out of nursing school. You have to have a minimum of 2,000 clinical hours in cardiac vascular nursing within the past 3 years. And you have to have completed 30 hours of continuing education in cardiac vascular nursing, again, within the past 3 years. So after meeting those requirements, you're eligible to sign up to take the certification exam. All of these certifications have exams that you have to pass before you get that certification. This certification is good for 5 years, and to renew the certification, you can either retake the exam or you have to accrue a minimum of 1,000 practice hours in your certification specialty, which for this would be cardiac vascular nursing. And it can be completed either through employment or as a volunteer. So all of these certifications would be good for me to obtain as they all either relate to cardiac or I should say, and or critical care specialties, which is where I will be working. The ECMO certification is a certification for a specific skill or process, while the CCRN and the cardiac vascular certifications are more generalized competency certifications while still being slightly specialized. The ECMO certification process is also, for a good reason, the most complicated of the three, seeing as patients who are receiving ECMO are some of the most critical and unstable. I think, honestly, out of the three that I've talked about today, the one I would be most likely to obtain is the CCRN certification. This certification is very versatile, meaning that it can be used in multiple different specialties, especially since I have been interested in multiple specialties where it's a requirement. So in conclusion, the three certifications, that I talked about would all be beneficial to obtain at one point or another within my career. All three have benefits to where I would be working immediately after graduation and what I would like to eventually transition to later on. But after reviewing what each certification is, the process to obtain it is, and comparing and contrasting each one, I've decided that the CCRN certification would be the most beneficial to my nursing career. And then here are my works cited. Thank you so much.